Good morning, everyone. Let me also warmly welcome you here to this, and Patty set it up brilliantly, but we really have had an amazing partnership planning this meeting, and it shows all over the place. So it's in evidence around you on the exhibit floor and the content, and we're so very, very pleased with the way this partnership has turned out. This morning, what I want to do is spend some time talking with you about a topic that's been on my mind for the better part of the last year. You know, when we launched the Internet of Healthy Things 2 years ago, we had such a positive response that the same team got back together and said maybe we should do something else. And the topic that rose to the top when we were talking about what we should write about next was health, technology, and aging. And of course, it fits right into the theme of our meeting today. So for all kinds of reasons, this is an exciting opportunity for me. So my same co-authors, Carol Coleman and Gina Cella, and I got together and just yesterday released a new book called The New Mobile Age: How Technology Will Extend the Health Span and Optimize the Lifespan. And what I want to do this morning is walk you through a bit of what we cover in that book, give you a sense of how we're viewing this very important challenge that we all have, and frankly, all have to rise to the occasion to be able to work on. So it's true, we're not getting any younger, either individually or as a society. In fact, for the first time in history, by 2020, there'll be more people over 65 than under 5. And by 2050, 16% of the world's population will be over 65, twice the number under 5. Now, why do I bring those statistics to point out the challenge? Because every time we do care delivery, whether it's caregiving as a family member or a loved one, or caregiving as a healthcare professional, we're doing it one-to-one. So you're all really bright people. You can do the math. We're going to run out of people to deliver care if we don't think about doing it differently. And that's a big challenge that we see. The other part of the challenge is how we treat aging. So the 20th century was the century of the lifespan. Did you know that we actually added 25 years to our lifespan in the last 100 years? My grandfather was 62 when he died in 1949. My father was 88 when he died in 2008, and with no catastrophes or unforeseen illnesses, I'll probably live well into my 80s and beyond. And that directionally is the trend we're all witnessing. So we added a lot through public health initiatives, medical technologies, and the like for the 20th century. But we haven't really thought as a society about how we're going to harness that extra 25 years. This is a good time for me to acknowledge my other collaborator in the book, who's Charlotte Yeh, the Chief Medical Officer at AARP Services, who not only wrote the foreword, but also just really helped me think through some of these very challenging issues. So a lot of what I'm talking about today is channeling some of her very important thinking as well. So the 20th century was the century of the health span, and we have to make the 21st century the century of the 20th century was the century of the lifespan. We have to make the 21st century the century of the health span. And what that means is we have to take that extra 25 years that we've created and add value back. Instead of simply patting people on the shoulder and pushing them off and saying, you're retired now, you can sit in front of the TV, maybe play some golf, and we'll take care of you. We have to be able to turn that around to an opportunity. And we have to do it soon because, as I said, we're going to run out of people. So we have to rethink completely how to do aging. In fact, we need to create a new kind of old. So I want to start by thinking through this with you. Is the population over 65 a burden? Well, it's interesting. In 1935, when they brought in Social Security, the average lifespan at that time was 62 years old. So you can just imagine the policymakers huddling in rooms saying, well, if you make it to 65, we'll give you a modest income monthly for the remaining few years of your life, I'm sure they didn't have any notion that we'd be living well into our 80s by now. And of course, in the early 60s, in comes Medicare. That's another big, big, big budget item for our government. So you can understand how certain people would look at this and say, absolutely, this is a burden. But there's another fine point I want to make, and we talk about this as well in the book, which is the phenomenon of ageism. I've certainly experienced it. I'm sure any of you with a little bit of gray hair in the audience have as well. But a story really, to me, sets this one up. A friend of mine is working in a company now, which will remain nameless. I think you'll understand why they're nameless in a minute. But he's 50 years old, so he's the oldest person in this company. And he came into our office the other day to talk about whether we could help them do some clinical validation. They're trying to take a service that you and I consume in brick and mortar and move it online, something that we think a lot about. But the point of the story is he was talking about his colleagues in his company, and again, he's the oldest person. He said they've given up, listen to this, they've given up that anyone over 50 is going to use this technology because old people don't get technology, right? Wrong, indeed. Indeed. Well, and I think that, if I were their investors, I'd be giving them a hard talking to. But the point is, we see this idea of ageism, and it comes at us, and we need to really, really address it as part of this movement between creating an opportunity for aging. So is it an opportunity? Well, people over 50 contribute $7.6 billion to our economy. I think that's probably an opportunity. Another colleague from AARP, Jody Holzman, who's quoted heavily in the book, has said that only the U.S. government would take the economic activity of 100 million people and call that a burden, right? Not an opportunity. So let's rethink it. Let's rethink it. People who are over 50 start businesses at twice the rate of people under 50. People who are over 50 have all kinds of things to add back, whether it's judgment, wisdom, experience, mentoring. These are all things that older people have experienced. They have a certain Zen-like view of the world because they've been through it so many times. And as I said earlier, our solution is to just sort of pat them on the back and move them aside, and we have to really rethink how we do that. So that's the premise of what we want to talk about. How do we take aging and turn it from a burden to an opportunity? I have a two-part strategy that I want to review with you. The first part is designing for an extended health span. And the second part is about re-engineering care delivery. And that's where I'm going to come back to that one-to-many problem that I talked to you about earlier. I'm going to keep hammering away at that because that really is the burning platform. We won't have enough young people to take care of all of us as we get older if we don't rethink how we deliver care. But let's talk first about the idea of designing for an extended health span. Now, this too comes back to really me learning a lot from Charlotte and how she thinks about aging. But you can see these three predictors of healthy longevity: a sense of purpose, social connections, and physical activity. And I'm going to go through each one of them now with you in more detail because they're very powerful. Now, the sense of purpose one is fascinating stuff. Most of the research that we quote in the book is by a local gentleman called Eric Kim at the Harvard School of Public Health, who's done a lot of work in this area. And fundamentally, all kinds of things come out when you examine people and you ask them about purpose and then you look at their health outcomes. So people with a sense of purpose have fewer heart attacks, strokes, fewer loss of functionality, fewer sleep disturbances. People with a sense of purpose have 32% fewer office visits to the doctor and 61% fewer visits to the hospital. We talk about readmissions all the time. Maybe our readmission strategy should just be to work on that. It's really interesting. And volunteers, it's interesting. If you look at them as a group, they tend to have more preventative screenings and tests, things like flu shots, mammograms, prostate exams, cholesterol tests, than folks who don't volunteer. So there's this deep-seated notion that if you get up in the morning with something that you think you have to do to make the world a better place, you're going to pay more attention to your health, and it really comes through. This is the most powerful, I think. Now, not to sell social connection short at all, and the simple fact on that is that isolation is as detrimental to your health as a pack-a-day habit of smoking cigarettes. And I'll leave it at that because I think we all intuitively know how terrible isolation is and how it eats away. I see all of these three things in my own practice. I'm a dermatologist, so I have the privilege of taking care of people, mostly older people, mostly healthy people. And so I just quiz them about these things casually, and it comes through that they all have really robust social connections. They all get up in the morning with something to do. And the third one, they all have some sort of physical activity built into their routine. The physical activity one is, again, pretty straightforward. We all know now that sitting is the new smoking, that if you can't get up and be active, it's not really good for you. But if you think about how we view older people in activity, we have some work to do. We will cart them around the airport in a golf cart. We'll park the car closer to the door. And somewhere between that time when you can walk briskly and you're walking maybe with a cane or a little bit slower, we somehow start to forget that the actual physical activity itself is beneficial, and we need to rethink how we build little bits of physical activity into people's lives. It doesn't have to be marathons, but little bits of physical activity into people's lives. Now, tackling chronic illness, and I said this is a big part of it. So it turns out that no matter how much we do to give you a sense of purpose, to make you happier, healthier, allow you to add back, eventually your body's going to start to give out on you. It's just physics. And so you'll have more touches to the healthcare system. Again, I see this in my practice. People that are older touch the system more. They're getting more of everything, more tests, more hospitalizations, more doctor visits, etc. And we need to be able to deal with that. And as I said, if we don't fix it, we're going to run out. We already feel like you get 7 minutes with your primary care doctor, etc. All of that is a symptom of the fact that we're locked into this one-to-one service delivery model. So we have to fix that too, a paradigm shift. And it's a really, really tough one for medical professionals is what's required. Other industries have done this. We just haven't been able to do it in healthcare. All right, so what role does technology play now that I've laid out the roadmap? Well, I wouldn't be in front of you if technology didn't have a role, because that's my passion. And I think you can probably see it has a role in all of these things. So in terms of a sense of purpose, think about all the opportunities now that you have to go online, sign up for some sort of program, website, etc., where you can offer your services like slicing salami. I'm going to sign up to be a mentor, to be a consultant, to give back from 4 to 6 on Tuesdays and Thursday afternoons, whatever it may be. But the internet and mobile has allowed us to be able to deliver services wherever, whenever, in such a way that we can still feel retired and yet be able to give back. Or maybe it's a volunteer job, or maybe it's taking care of grandchildren. But we have to be able to build that into our public health. We have to build that into our policies, build that into the way we think, and technology really, really has a big role to play there. The social connection one is, again, obvious, but you know that the people who have the 10% most Facebook friends have much longer lifespan than people who have the 10% fewest. So Facebook already is out there. I'm always warmed when I go to the airport and I see an older individual FaceTiming with family members before they board the plane. I see that a lot. These technologies are now becoming ubiquitous, and we need them. We need them to stay connected. The more we become less able to get around, the more we need them to stay connected to our loved ones. So that's a bright star on the future for sure. And of course, physical activity. Now, one of the other interesting things in our book is we spend a few pages on how Fitbit has changed their business model. And Adam Pellegrini's here. He's featured in this passage. And how they're really looking at health and aging as their next big thing. And it's true that activity trackers are becoming more prevalent in this age group. 17% of people over 65, according to an Accenture survey, will use a tracking device, and only 20% of us under 65. So we're actually directionally headed in the right direction for this. So I think this part, although we still have work to do, it's more mindset than technology. The technologies are in place to help us with this. This is a different story. This is a real challenge because, once again, as healthcare professionals, we just think you have to come into the office. And most patients and consumers just think they have to come into the office. But we all know, and there are many, many people amongst you in the audience who've had experience with remote monitoring tools and various programs, and know that you can have one care provider managing by exception, managing hundreds of individuals. And if you set it up right, they will feel more cared for. They will feel more connected. We've seen this in our own program. And one thing to move this forward that I really want to shout out to my colleagues, that many are here from the AMA, because they've really taken a leadership role in trying to move payment models forward to support this kind of activity, and it's incredibly important. So big thanks to my friends at the AMA for that, and for being able to help us realize this future where we can start to do one-to-many care, because we need to do it to get there. So again, as you might expect in any book that we put together, there's going to be a lot of discussion about technology. These are 3 examples of technologies that we can use to extend human beings to one-to-many. The one on the left is a robot by Catalia Health. The one in the middle is also, these are in-home robots. I think the important thing about them is they're getting more and more affordable, and they're getting more and more human, if you will. And on the right, another one I just love to death, which is a Joy for All companion by Hasbro. About $100 for this a robotic cat that can be a real companion to someone who's old and isolated. Now, before I leave this slide, and there are lots of other examples in the book, but before I leave this, I want to really drive home a point that none of these should ever be used to substitute for human connection. That's a bad use of any of these technologies. But to extend when you can't be with your loved one and because you have a life, or to in a care facility where you just can't have enough people to get around, if these things are thoughtfully designed and brought in, they will be able to drive home that connected care feeling that individuals will need as they grow older. But we have to design it right. So that's really it. If we can use technology to extend those 3 purposeful, a sense of purpose, social connections, and physical activity, those 3 extenders of the health span. If we can get our act together and re-engineer care delivery, we can make the 21st century the century of the health span. But I promise you, we all need to get together. We need all of your help in doing it, and it's something we can all talk about over the next 48 hours as we spend together. Thanks very much.